there's a lot of disagreement even within the different societies. So I'm a urologist. I love the American Urologic Association guidelines. Guidelines are not the Bible. It is not the law. It is just sort of a general guidance. And so the AUA, American Urologic Association guidelines, put us at about 300. And so if your testosterone is below 300 and you have symptoms, remember, just like Dr. Schwartz said, you're feeling fatigue, you've got low energy, you're falling asleep at dinner, your erections are not as hard, your libido is not as strong, and you're below 300, well then, yeah, I'm going to qualify you as having low testosterone, and your insurance will probably pay for therapy or certain therapies. If you're at 306, and you're feeling all of those symptoms, I'm still going to diagnose you as having low testosterone, and I'm going to recommend therapy, but your insurance company might not pay for those different options. Now, if you look at the Endocrine Society guidelines, their threshold is different. And so it's really important that who's reading your labs, and a lot of primary care doctors don't really have guidance. And so they may look at the range that the LabCorp or Quest or whatever lab is reading, and they say, oh, well, it's in the normal range, so you're normal. Mm-hmm. And that's not always true. And so it's really confusing when you're just a guy who feels like crap, who just wants to feel better, and you're getting 6 different answers from, 5 different doctors. And so it can be really challenging to understand that. So what I would say is my general rule is if you're below 300 and you're having symptoms, then we should treat you. If you're below 300 and you feel great, then you're fine. You're normal. We don't have to treat you. And so it's important to, talk to somebody who's going to listen and say, okay, here are the pros, here are the cons. Because if you're below 300, but your erections are great, you've got good energy, you're working out, you feel good. Why would I put you on a therapy of something that you have to do every single day, potentially for the rest of your life, right? It doesn't make it, if you're not broken, I don't want to fix you, if that makes sense.